Good morning to all of you, and thank you so much. First of all, I would like to thank our Director of Public Health, Dr. Silva sir, and also all the organizing committee members, and particularly Dr. Vinay and his team, who closely followed with me for this participation. And you have planned in such a nice way, and the topic also that has been chosen is a very, very apt topic for the Tamil Nadu. So thanks again to all of you. Now, many of the things which I wanted to convey to you, a glimpse of that has already been conveyed by Dr. Selva. And that is what is the roadmap for the strengthening, but I would like to further give you some more inputs so that you people can do it forward. This one? Down one. Okay. So, my first thing is you are progressing well. There is no doubt of it. And I have seen it. I have seen it from my own eyes. If you see all the parameters, MMR, IMR, under 5 mortality, everything is better than what India average is. And not only that, many of the government of India initiative you are undertaking, and besides that also you have undertaken so many additional things. The first to enact the Public Health Act. Only a state with distinctive public health cadre initiated round-the-clock service. I vividly remember your protocols became the protocols of the government of India. Be it 24/7 PHC, be it CMOC centers, BMOC centers, life-saving anesthetic skill, emergency obstetric care skills, MVA, maternal death review, MNM, n number of protocols which the Tamil Nadu initiated later on became the Government of India protocols. So your achievements, I am not going to read all of them. It's immensely good. Besides that, you have also initiated many of the specific programs for the particular diseases and particular situations. That is also in itself has yielded result, and it has shown the path to the whole country. Many of the states are copying many of the good efforts that you have already done. Sorry. So now is the time to think. I have not enlisted all the positives because it's a big list and it will take time. But now is the time to think, as Dr. Selva is saying again and again, and yesterday also during the inaugural, it came. You have this epidemiological shift. You are well aware about it. But what you have to mark is what Dr. Selva said, that health should be in all policies. Health cannot be tackled alone. So this is very important, and this capacity should not be there limited only from the state to district. You have a big public health team. It should go up to the block level. Every block should think about it. Now, if you see the nutritional status, anemia, stunting, wasting, TB notification rate is very good. The treatment success rate is also very good. But if you see in the private, how we can achieve the target by 2025 to get it 100%. Your urban health indicators, again Dr. Salva said in the morning, obesity is a problem, high sugar level, elevated BP, so premature mortality. So all these needs to be now specifically targeted and thought about properly. If you see Gini coefficient, if more value towards one, more inequity. And again, Dr. Selva said that we have to focus equity. I too agree with him. If you see that with Kerala is almost 0.1, 0.15. So still you have high inequity, and you have to focus in those areas where it needs more attention. By reaching to the unreached will help in reducing the health inequity. Out-of-pocket expenses. If we talk of the inequity, one of the big factor is the out-of-pocket expenses. And even in government health facility, it is high. But if you compare to the private, it's, government is quite good and private is so high. So how you can do that, and how to reduce this catastrophic expenses, because our national health policy says that you have to bring it up to 25% at least. So that you have to target. Then your commitments, national, international commitment, the state commitments that you have to achieve, SDG, national health policy, universal health coverage, resilient health system, and so on. Sorry. Now, what I suggest is, you should have district and block level planning. You should think about the population, the disease burden of the population, and that will vary from one district to another district. What is the surgical? You saw the out-of-pocket expenses. What is the surgical needs of the district? What is the cataract needs of the district? What is the dialysis needs of the district? And he rightly said, dialysis is just a short-term, thing. Your visionary approach should be to control the hypertension and diabetes. But till then, you cannot allow the people to suffer. So all these, what is the emergency care needs of the district? And what all you can tackle at the primary care, so that the load on the tertiary care is less. So your plan should now specifically focus on the district and also at the block level. You have opportunities. It's not that you cannot do it. Besides the funds given under the National Health Mission and state's own resources, you have so many opportunities like 15th Finance Commission, Ayushman Bhav, and ABDM. And besides that, CSR funds are there. Now district-specific funds are there, mineral funds, minority funds. So many types of funds are available at the district level. None of the district heads approach the district collectors for these funds which are available other than your assured funds. You should reflect your requirement of assured funds only after utilizing your other sources of funds, because your state fund, your NHM fund is your fund. You can always utilize it. But you try to explore, first of all, whatever you can take it from the other sources. So that is very important. And then readiness and preparedness for epidemiological shift, climate change, and then demographic shift. Rapid urbanization is a big problem, and it is coming out. So how you can address this? So all these are the needs of the focus, and that will lead to the health outcomes of reducing mortality and morbidity. So what is needed? If you have these many burdens, then what is needed is a comprehensive planning. And if you recall, when the beginning of the National Health Mission, this planning was focused a lot, and even the district-specific plans were asked for. But somehow we have become we are more towards disease-centric plan. We are more toward tertiary care-centric plan. We should come to the primary care plan. We should try to first utilize the opportunities which are low-cost opportunities. Giving primary care is a low-cost opportunity, and that plan this plan needs to be made comprehensively so that you can pick and choose where to prioritize, what to prioritize. And you should think investment in quality human resource in health. If you will not invest in human resource in health, you cannot achieve the quality. You cannot achieve the equity. You cannot do the population coverage. How you will do? You will need human resource, and that is very important. You should think district-specific. National Health Policy says 2 per 1,000, and Indian Public Health Standard says 1 bed per 1,000. So invest in your bed ratio. If you feel now that the maternal and child health wings and beds are more than enough, maybe you invest less there, and investment should be more towards those areas where you need. But always focus on assured service delivery with aspirational goals, ensures a standard, NQAS, IPHS, and so many other standards are there. And convergent actions are very important, because unless health, you converge with every department. COVID is the example. India can do it. COVID alone probably cannot be well tackled just by the health department. But that is a exemplary situation when every department came forward and we were able to tackle the best possible solution. Community engagement, addressing need to the district plan, and concurrent and periodic monitoring with a patient-centric approach should be your the approach for the planning. And this can only be done if you have a district-specific plan focusing both health facilities and the community. And the way forward that I feel is green and climate resilient infrastructures, critical care. You have already invested in critical care. Utilize PM Abhim and 15th Finance Commission. This is the best opportunity. You have so many people in the district with the public health, expertise. But now we are saying block public health unit. It's unique. And that block public health unit should be the platform for One Health, should be the platform for all your programs. And that also have the opportunity for a public health professional there. And multidisciplinary team, intersectoral convergence, ensuring essential medicines, diagnostic, all these things will help, and that will help in increasing what you have to do is increase the healthcare financing, reduce out-of-pocket, primary care, universal health coverage. So all these are the way forwards for you, and this can be achieved through strengthening building blocks of the health system, which is very, very important, generating evidence, investing in research, IT, governance, good governance, diagnostic, medicines, human resources, quality service delivery, healthcare financing through increased, state share in the GDP, and developing service infrastructure and your general infrastructure for your health services. These are the some of the strengthening building blocks that you can utilize for improving your program. So thank you so much, and thanks again for giving me this opportunity to deliver in front of you. Thank you.
Now it's open to the question session.
The session is open for questions from the audience. If anyone wants to share more light. Yes, sir.
Thank you, sir, for the excellent talk. The Government of India is planning for a healthcare policy as such. Can we have a separate primary healthcare policy which will just focus, as you rightly said, unless we strengthen the primary care? So can we convince the government to bring out a primary healthcare policy addressing the primary care needs alone instead of getting diluted disease-specific and secondary?
Sir, this policy is already there by Government of India. So, focus on the primary healthcare Government of India. That's why, if you will recall all the health and wellness center, 12 primary package of the services, including what Dr. Silva was saying about the mental health package and other things. It is already there. What we need to do is now start funding about it, thinking about it, and implementing about it.
Sir, good morning, sir. One more. Sir, here. Sir, regarding tertiary care, for all medical colleges, we have a National Medical Commission to ascertain the manpower, human resource to be positioned in all medical colleges. But for primary care, we have IPHS, Indian Public Health Standards. But even having an IPHS standard, but the HR, the human resource to be positioned in the field is not adequate.
So, Dr. Mona ji here from NHSRC, who is an expert in HRH, she can always add. But what I would like to convey is that tertiary care is already governed by a council, because it has not only a curative responsibility but also the teaching and training. So, and these standards are, which are there in the Indian public health standards, are not by and large focused for the teaching standards. It is more towards preventive, promotive and curative care standards. So these both these standards cannot be met. But as far as the meeting the shortage in the human resources are there are the various means besides passing out of the. She will be able to tell you and give you the data that how many human resource we are producing, but we are not properly getting utilized them. Maybe there are the issues, and that's why Government of India came with the public health management cadre. I am not talking of this specifically for Tamil Nadu, but for many other states where career progressors. So you have to attract your health professional in your service, and besides that you have the opportunity for capacity building, training, task shifting. So there are so many opportunities for attracting human resource. Thank you.
Thank you very much, sir. India can do it. Your quote holds well. Thanks for emphasizing the leadership role played by our state of Tamil Nadu in public health programs and showing the future challenges of equitable distribution, reducing out-of-pocket expenditure, emergency care at primary care to reduce the need for tertiary care, and showing the way forward for climate resilient health infrastructure and universal health coverage. Thank you very much, sir. We request our director to facilitate the speaker for the session, Dr. Himanshu Bhushan, sir.